Assalamu alaikum. The communication day. The first scenario. Mrs. Mona, she is 55 years old, admitted 2 days ago after extensive ischemic stroke with her left side weakness. With left side weakness, 24 hours after admission, her condition was deteriorated and went into a coma. Repeated CT brain didn't reveal any interval change. Since day one of admission, she received aspirin in the best interest of her condition and pantoprazole for peptic ulcer protection. Her daughter, Mrs. Layla, is very anxious because of deterioration of her mother's condition. She is very angry because of aspirin therapy, as her mother had history of upper GI bleeding 2 years ago as a result of aspirin. You're, you are the senior house officer of medical department on call today. You have been asked to discuss this condition with Mrs. Layla. Are you ready, Dr. Muhammad?
Yes, good evening. Hello, Mrs. Layla.
Hello? Yes?
Hello, how are you? I am Dr. Muhammad. I'm resident internal medicine. I'm on call today. Are you Mrs. Layla?
Yes, doctor.
Okay, are you the next of kin to the Mrs. Mona, 55 years old?
Yes, doctor.
Okay. Mrs. Layla, today we are going to discuss some important issue about your mom's condition. Are you ready for this conversation?
Yes, doctor, please.
Okay, before to start, I need to make sure, did you get any permission, or you are the best, or you are the best interest of this patient?
She's my mom, doctor. Yes.
Okay. Okay. Mrs. Leila, today we are going to discuss an important topic. Okay. But I want to make sure if you need anybody else to be attending this room.
No, doctor.
Okay.
No need. Yes.
Okay. Do you tell me how much do you know about your mom's condition?
Yes, doctor. Actually, my mom get a stroke 2 days back, and she had left side weakness. For that, she was admitted, but she was conscious, doctor, and she was communicating with us well. But I don't know what happened exactly because she went in coma and she cannot speak with us. And I think this is a mistake from your team, doctor, because I told them not to give her aspirin. She is allergic to aspirin and she received it 2 years back and she got bleeding. That's why I told the treating doctor and the team that please don't give her aspirin, but I don't know why they gave her. And I think this is all happened to my mom because of this aspirin, doctor.
I'm so sorry for what you are feeling, and I'm ready to help and giving you a detailed instruction and information about this situation. Okay. Do you know how much about the continuous care of your mom? How much do you know about this care?
Yes, I know that she get stroke, doctor, and she was admitted because of this, doctor.
Okay. Okay. Mrs. Leila, as you are informing me about this, I need to make sure that your mom's condition is like the following. Initially, she was admitted to the hospital and complaining of ischemic stroke and left-sided weakness. And as you discussed that aspirin being received by her, but unfortunately, she has get some complication, but just want to make sure that this complication might be from the original original problem like the stroke itself, or might be from some medical complication. Okay. And as you mentioned that the patient was complaining of aspirin allergy. I'm so sorry for this side effect, but and I'm sorry for this side effect that the medical team didn't get it. Okay, and but the aspirin was the very important and critical treatment in this scenario. and your mom's condition was not responding to any kind of treatment apart from this medication. Okay, are you following me?
Yes, doctor. How she is
Okay.
responding to this medication? She got comatose, the doctor, after taking it.
Okay, as I mentioned, the stroke by itself or can make the coma, okay, and the aspirin can make the coma through the hemorrhage. But fortunately, your mom's CT scan or scan of brain shows no significant changes, including the hemorrhage. Okay, that's point to something like aspirin cannot be directly related to this scenario, to this medical status for now. And your mom's condition was critical initially, and it was life-threatening. And fortunately, our medical team was doing the best interest for this patient and giving the aspirin according to her best interest. And they also gave pantoprazole to prevent the stomach ulcer prevention. Is that all right with you?
So she is in coma not due to bleeding in her gut, doctor, again like before 2 years ago?
Okay, we have to make sure that the condition is related or not. Let's make sure that the coma is originally the problem of central nervous system, and anemia or loss of blood can make loss of consciousness or can make decreased level of consciousness, but not in the level to reach the coma state. Okay.
I'm not convinced, doctor, but what you say, sorry. Because my mother, I told you and your team that my mother is allergic to penicillin. So, how you are sure that my mother is not bleeding in her gut?
Okay, as far as we are giving the gastric protection treatment, like pantoprazole, the possibility for aspirin-induced bleeding is less likely, and usually almost around 5 to 10%. And it will be dramatically respond to the anti-acid, although it's not 100% prevention, but we can say the aspirin can be prevented, the aspirin-induced side effect can be prevented with this treatment. But I want to make sure that you are under the continuous care of the medical team, and they are doing the best for this patient. And we are continuously get updated by medical team about your mother's vital signs and the conscious status, as well as the general medical situation.
Mm-hmm. Okay, doctor. So, you told me my mother in critical situation right now, right?
Mhm. Yes. Okay.
So, doctor, do you think that I have to call my brother to see her as he is living in another city?
Actually, the situation now in the critical situation, okay, she's been admitted in the critical unit. We are, as a medical team, we are allowing for the one who is responsible for the best interest or uh, best care of this patient. Mm, okay, we can also advise for some medical team, or including the hospital registration or social support in our hospital to allow us with this issue.
2 minutes left.
Okay, doctor.
Okay. Mrs. Leila, may I ask you some question?
Yes, doctor, sure.
Your mother was under or we can say, is there anybody in your home depend on your mom's?
Yes, doctor, my sister.
Your sister. We can arrange a social worker for her to help with this situation. How about her general financial state in home? Is she good financially?
She is okay, doctor.
She is fine. Okay. As far as we are here, we can offer the best support for you and your family, and we can give the detailed information as well as to your brother as far as he is concerning about this scenario. And okay, is that all right
Yes,
with
doctor.
you? Okay,
Okay,
I'm
doctor.
wondering, Miss Leila, how much did you get from our conversation?
Uh, yes, doctor. I got that you admitted my mother by the stroke and she received the aspirin, and you told me that the aspirin is not the cause, but for her coma now. But the coma may be due to the condition in her brain,
Mhm.
and also she is in critical situation right now, doctor.
Okay, I'm sorry for that again, and we are giving the best support for you and the family. And I will also give you some leaflet and brochure, including the detail of information about the coma and ischemic stroke. And we can offer the best possible in here in this hospital.
Okay,
Okay,
doctor. Okay, thank
thank
you.
you so much. Thank you.
Yeah, time is up.
Thanks.
Well done, Dr. Muhammad. Well done. Really, as first attempt with me, it's
Yeah,
perfect. Yeah, I know
it
you
was a
are stressed.
difficult
I
scenario.
can. It's difficult scenario, and you are also. You. It seems you are stressed. Yeah, but no worry. You did it in a great way. Okay, well, let's hear Dr. Phoebe, then I will comment. Please, Dr. Phoebe.
Yes, well done, Dr. Muhammad, but I have some comments to learn together. Uh, okay, you have some jargons like ischemic
Mm.
and like CT scan better to see brain image.
Then,
And also, I think, I don't know if Dr. Basim will agree for that, telling her this patient every time,
Yes.
I know,
Yeah.
I think it's not good because
Yes.
she is
Exactly.
her mom. So, yeah. Regarding to the introduction was okay, but I think you didn't ask her if she know about stroke and if she want more explanation about the mother condition. So if she told you, okay, I know everything about her condition and I know what is a stroke, خلاص, you can escape this. But if she told, like, if you ask me this question, I will tell you I don't know what is stroke exactly, doctor. So at that moment, you can explain more about stroke
yes.
by telling her in non-jargon words the stroke is like a blockage in the blood channel supplying a brain, and this is the cause of her weakness in the left side of the body. And actually this caused the damage of large area of the brain, and unfortunately she get deteriorated because of this with altered conscious level. And we repeat already the image again, but no changes can be found.
Mm.
At that point you can try to calm her at that there is no changes, no bleeding again inside the brain or any issue. uh, okay, and the other issue to explain more about the importance of the aspirin, like to tell her that aspirin is prescribed in your mother condition for the best interest of her case, as it causes thinning of her blood and therefore decrease the chance of blood clot to progress more. And the other issue that she has bleeding in the gut, and bleeding in the gut 2 years ago, it is not meaning that she is allergic to aspirin. This is another point. And for that she has bleeding 2 years ago from aspirin, that's why we give some medicine for protection of her gut, which is pantoprazole. And what happened to her is not related to aspirin. She is not allergic to aspirin and she didn't bleed in her gut. So at that point, she will tell you. The concern of her, how you know, doctor, that she is not bleeding in her gut. So you can tell, as you tell, that we give already protection against aspirin for the gut, for stomach, and also we are. Hmm? Hello.
Go ahead, doctor. Go ahead, doctor.
Yeah, and also we are monitoring her very well because if no drop in the blood count, if there is no dark stool, if no bleeding per mouth, so at that moment we are sure that there is no bleeding in her gut and the all deterioration in her condition because of the damage in the brain area supplied by this blocked blood channel. Also, the other concern raised by this patient, by this daughter, that when she told, "Do you think I have to call my brother to see my mom because he is living in another city?" So you can tell her, yes, you better to inform your brother because her condition now is critical. And if he wanted to clarify any queries or any question about her condition, we can do a meeting on phone and replying all his question and all her queries, his queries about your mother condition. Okay. Yes.
Yes. Thank you so much,
Yeah.
Dr. Fiba. The
But
problem is was okay.
But
Okay.
I am happy that you are not taking the scenario in
Medical error way.
medical error because it is
Yes,
not medical
perfect.
error. Yes,
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 No,
yes.
yes, no.
perfect.
The problem, Dr. Bassam, this is the first time I'm dealing with medication side effect or some medication problem.
Dr.
Uh,
Muhammad, you are in the right track. You are doing great, really, as a first attempt. No worry about it at all. At least you didn't mix the task. You didn't say this is
no.
an error or mistake, because anyone in your place might say, "We are sorry about this. Suppose not to give this medication." No, the medication given in the best interest for her condition. And I'm so sorry for the bleeding happened before. Now we are taking care of this. We are giving protection to the gut, as Dr. Phoebe said, and we are trying our best not to have side effect from this medicine again. However, her condition and deterioration is not related at all to the aspirin. What happened is related to the stroke itself. And as Dr. Phoebe said, you can explain the stroke earlier if she asked you, "I don't understand what's happening," or if she said, "No, doctor, I can know everything about the stroke. Please let me know about other concern." Then you can address the other concern. I want to
Dr.
comment on,
Bassem,
yes, yeah, Dr.
I
Salmi.
I wasn't there from the beginning, so if he mentioned what I am about to mention, excuse me. So, Dr. Muhammad, you said that you never practice a scenario about medication
Medication.
side
Yes,
effects.
yes.
I was in the same place as you before somebody told me how to practice this. So when you are telling the patient the surrogate or the relative that this is a side effect of a medication, he will not be convinced because he don't know. In order to make him know, you have to explain the medication first before
True.
anything. So from the beginning, you ask the patient how much you know about the condition of your mother. She will tell you that she came here because of a stroke, and then treated her, and then she went into coma. Then you will fill the gaps. If she didn't mention anything, you will mention for her. One of the things you will mention for her that the team gave her aspirin. So let me just explain to you the condition when the team gave her this aspirin. The condition that your mother suffered of is a stroke. Do you know how much do you know about the stroke? She will tell you, as Dr. Phoebe said, I don't know anything about that. Then, and this is what will happen in the exam because they want to give you a chance to explain. So you will explain that a stroke is when somebody have, and you can draw also a clot because it's ischemic, right? Not hemorrhagic. So when somebody have a clot, this clot is very important to mention because you are going to link the importance of using aspirin to this word. You will tell her a clot in the blood channels that lead to less blood coming to the brain, and then as a result, the brain suffer from lack of blood and a stroke happened. So, in order to dissolve this clot, we are using some medication. This medication called a drug to dissolve the clot. One of them is aspirin. Aspirin is used in the best interest, and that is dissolving the clot in the blood channel in order to make more blood coming to the brain and make
Excuse me, Dr. Salma, but
yeah.
for the dissolve, you are talking about thrombolytic.
Yeah,
Aspirin,
it is thrombolytic.
yeah,
And what is aspirin?
yeah.
Why
Aspirin
why
makes
we are giving aspirin?
prevent
Prevent
further,
further
yeah,
strokes.
yeah,
It's
prevent
okay. So
further, yeah,
excuse me
clotting.
because I
No,
explain.
no worry, no worry. It's okay.
Yeah. So you explain what is aspirin used for. Uh, as Dr. Basim said, and I will revise the definition again. So the aspirin used to do so. I mean any drug, if thrombolysis are used to do so, if steroid used to do so. When you are explaining that this is the condition and this is why we use the medication, at this time, and also by drawing, the patient will be convinced that the medication is in the best interest. Otherwise, if you say it hundreds times, the patient will not be convinced. He will ask you again. So in order to use your time wisely, you explain first the medication. And then also one of the important part of the explaining the medication and which make you make the patient believe you, explaining the side effect of the medication. So aspirin, one of the side effects of the aspirin is sometimes that it will cause bleeding. In your mother's condition, we know that from the history, and the patient should know that you know the history. That means you did not make mistake. You know the history. That from the history of your mother, that she suffered a bleeding from the gut 2 years ago from using aspirin. That's why the team gave her pantoprazole in order to prevent this from happening again. Like this, do you think that she will doubt why giving aspirin? She will not, because you explained clearly to her that we use aspirin, and we know that aspirin in your mother condition have one of the side effects before, and that's why we use another medication to protect from this side effect to happen again. Like this, you will be very justified, and you will not need to spend time to maybe the surrogate will not ask you again because they give him clear instruction to ask if you did not mention.
Yeah,
I hope that
perfect.
was clear. Yeah.
Thank you,
Yeah,
Dr.
it's clear. Thank you, Dr. Salma, for more justification of the scenario. Let's go back to the introduction, Dr. Muhammad. When you tell her, did you get permission from your mother to talk about her condition? This is not the way. You can make it the opposite. Okay? You will say that we assume that we have permission from your mother to talk about her condition if you want. Since this patient in coma, no need to mention this word. Patient already in coma, right? So she
Yes.
lost the capacity at all. And for this also, I put my video down. When you invite someone, what you did is perfect. You can invite anyone because it's breaking bad news and the mother already in coma, so she lost the capacity. No need for permission, and you can invite someone else to attend the meeting. If her mother is still in her capacity, you have to assume that you have permission from the mother, and you will never invite someone to attend this meeting because this is her confidentiality. So again, in this condition, you can invite because she's in coma. No need to assume permission because also she is in coma. Okay, clear? This is for the introduction.
Yes, I get
Okay,
it.
but yeah, for the jargon, as Dr. Phoebe said, and please, before going more about the comments, can you post your scenario for Dr. Phoebe? And I will comment about the jargon. You said, yeah, we are monitoring the vital signs. As Dr. Phoebe said, the CT scan. Try to make your words as simple as you can. As Dr. Phoebe comment, scan for or imaging for the brain, and the vital sign you can say we are monitoring her closely for her condition. No need to mention vital or whatever. Also for the side
Recording in
effects,
progress.
sorry. Yeah, for the monitoring also, you have to say we are monitoring her blood count in order not to have again the blood loss. Okay. At the end, in this condition, in this scenario, you have to ask about lasting power of attorney and advance directive. Why? Because this patient might die within days, maximum weeks, right? She's in coma and you don't know what will happen. So it's better to ask about any wishes she expressed in the last days of her life. Did she document any paper? Does she want or did she want anything to be done for her regarding her medical condition? She will tell you, yes, doctor, my mother wished to die at home. So you can say to her, okay, we are respecting this and we are always respect the wishes for any patient and we will try to follow this wish and to let her die within or at her home with your family or within her beloved person. The lasting power of attorney, the question will be, did she nominate anyone to take a decision on behalf of her if she lost the awareness? She will say no or yes, according to the scenario. And the last point I want to comment on, when she said, as Dr. Phoebe said, I'm just repeating for more explaining and stressing on this important point. When any patient will die or suspected to die or expected to die in the coming days or hours or weeks, or the condition is deteriorating, be sure that everyone in her family can visit her to see her for the last moment. Why? Because this patient might die after hours, couple of hours, and she asks you, doctor, will I call my brother? And you didn't allow her, or you didn't encourage for that. You have to encourage for that. Yes, please call your brother to see his mother. Why? She might not be there after a couple of hours. And she will blame you, doctor. You didn't let my brother come to see my mother, and it was the last moment in her life. So encourage any patient deteriorating rapidly, encourage the family to come and to visit her. Even you can break the rules of the visiting times. You can allow the family to sit with the mother or with the sick patient with her in the room for the last moments or the last hours of her life. They prefer that and they allow this for her. And if the patient in ICU, they can send the patient outside ICU to let the family sit with her or with him. Okay, all these things, it will be better with the practice. No worry about that. As a first attempt, again, I'm saying it's great to practice, and in the first attempt you didn't mix between error and complication. You clarify this is a complication, not an error. So for me, you did the task well, apart from this small mistakes for me. Okay.
Thank you, Dr.
So,
Bassem, for all this clarification.
yeah,
It
most
was
welcome,
a
Dr.
very beautiful and challenging case at the same time. Suppose Dr. Phoebe should be more angry than this. She was very calm and
Yes. Yeah, and you ask her in the beginning, how are you, Miss Layla? Maybe this question, believe me, this big question might calm any patient or any surrogate. How are you? How do you feel today? How's your mother now? As an introduction before starting, she might be really calm and supposed to be angry. By this question, she might be calm because you make as a friendly conversation with her. How do you do? How's your day? All these things make the angry person, at least if not angry or aggressive with you, maybe it will be less aggressive with you. So try to start your conversation in this way. Okay,
yeah.
keep it as a conversation way, not as a task to do. I'm here to talk with you, not to have a task from the exam way. No, I'm here to have a talk with you, friendly, talk freely. If you feel something, please let me know. Okay. Any question or comment for this?
Allah, Dr. Basim, I thank you for these comments. We get much benefit from it, really. But I wanted to ask you about
Yes.
my scenario before. It was about medication. And At that time, it was bronchial asthma, and the patient has acute severe asthma. And my senior asked me to يعني conversate with the surrogate about starting inhaler steroids.
Okay.
And this surrogate, he say no. She was female. She say no, no, no. I will not take this corticosteroid. Then I asked her why. She said because I have one friend and this friend become very obese with the corticosteroid. I told her this because he received oral tablet and this for long time, at least 2 to 3 months to do side effects. But here we are using only local, and it is inhalation, and it is very
Yes.
small, very less likely to do any side effects of the corticosteroid, you know.
Exactly.
And I advise you also to gargle by water and like this to remove any remaining to avoid
Yeah.
infection and fungus. And after and I said her also for her that anything in life has benefits and drawbacks, and this is life-threatening condition, and they may go to ICU and the intubation, ventilator, and life-threatening condition. After I finished with the surrogate, I saw the examiner very angry with me. Why you don't talk about side effects of corticosteroid, hypertension, blood thinning, osteoporosis? I
Oh
said,
my God.
patient surrogate already refusing to use local. I will discuss side effects and prevention system. He said, yes, you should do this. And he failed me. He gave me 6/16, and I
Oh
fail
my
in
God.
this stick.
Oh
Because you
my
have
God.
to be because you have to be honest. In
Honest for
their
what? Sorry,
practice,
Doctora.
in their
Doctora,
I yeah,
Doctora
in
Salma.
their practice, yes, in their practice, it
Again,
is better. You should not push the patient to accept any medication or push him to refuse any medication. It's his right. His right. So you validated his right when you minimize the side effects. You should mention all the side effects of the steroid, because tomorrow, if she have any side effects from the steroids, you minimize it during your conversation. She will complain against you and the hospital that the doctor told me this inhaler has less side effects, and side effects will not happen to me because it is less in the dose. I believe steroid in all the yes, it is less dose, and you have to mention this, but still you have to mention the side effects from steroid can happen, but it is important in your case to take this because asthma is more serious, and the side effects could
Okay.
be so all the side effects you should mention. I, I think there is like 6 side effects of steroid, very important to mention in basis. That
Yes.
what the examiner told you about the bone thinning, these things that the examiner told you. It's very important to mention them all, and then after that you tell her يعني استطرد على قول العرب that these side effects are less likely to happen to you because the dose is less, but it is a side effect of steroid, and the steroid is very important in your condition, and you have full right to refuse the medication, or you should highlight the ethical part, because the examiner will not ask you about them in basis. So you highlight by saying it is your right to choose to take this medication or refuse it. We are not going to force you to take it, but it is in your best interest. After mentioning all the side effects, I believe that is
Okay.
the condition. Yeah.
Okay, Dr. Salma. Respecting your opinion, let's say in another question and in another comparison, will you explore the systemic side effect or the local side effect? Let's imagine if he mentioned the systemic side effect without mentioning the local side effect, which is the fungal infection, candidiasis, and stridor, and so on. So, which is common with this? I agree there is side effect and possibility, but at least he give her the way how to use it and the precaution. This is the most important in inhaler.
Yes,
I don't
6
know.
from 16 is is
Yeah,
unfair.
I
Yes.
believe that yeah, he's
Yeah.
unfair. But believe me,
Okay.
Dr. Mohi, some examiner, maybe because of something you did it, they will fail you for any reason. Maybe for the introduction, maybe for a question, the way you talk. I don't know what you did exactly and the whole performance, but yeah, sometimes the examiner, if you do something, he will fail you if and whatever you do in the whole performance. Okay, so forget about it. Just look forward for the next time. Inshallah, you will do the best. And always remember, as Dr. Salma said, remember to mention there is side effect if you want me to explain it, or at least you can tell her, I can provide you with leaflet brochure. You can read about the whole side effect. And please, if you have any inquiry, please let me know. I will address all your
Yeah.
concern.
And Dr. Muhyiddin, our referral always is NHS, right? They wrote here the inhaler side effect is sore mouth, hoarseness, cough, oral thrush, like you mentioned. But they wrote also, if you are taking a high dose for a long time, there is also a small chance you could get some of the side effects of steroid tablets, such as increased appetite, mood change, difficulty sleeping, and so on. So it is mentioned in the NHS site. That's why they are angry about about you.
I
I
think
think not only
you are
this.
right. I think you are right, Dr. Salma, that he
Mm.
taken briefing from my talking with the surrogate that I
Yes,
push and try to convince her
Bush, yes,
to
to take the
take
medication. This
this
is validation of their ethics. They are not caring about what you say, but they are caring about their ethics. In their ethics, you have to mention this. You highlight the ethics during the communication. It is your right to accept to take this medication or to refuse it. But it is in your best interest that we describe it for you because asthma is very serious and this medication will help prevent you from the seriousness of the asthma. You
Yes,
should
yes,
highlight this sentence that you know
yes.
the ethics. Yeah.
yeah. So this is the reason why they give you this mark and why they make this reason as the general cause of your fail. I think it's not this is the point or this is not the concept. I think maybe yeah you push toward the medication more than making it as a neutral. There is side effect. There is also uh, advantage of this medicine, and we always say both of them. But since you didn't mention the risk of others, I mean unwanted effect, yeah, it might fail you in the whole performance. And again, the examiner, they put this as a reason only to put this mark and to fail you in general. Okay. So no worry, don't worry about it. With the practice, you will overcome this problem. You can do it in the next time. Hopefully, inshallah, you will do it in the best way.
Thank you. Thank you. Yes.
Most welcome, Dr. Mahi. And anytime you want to practice, please message me privately. I tried to look for your number today, but I couldn't reach you.
No,
And I don't know
I have
exactly what's
shortage
your
of station 5 more. Station 5 is very
anything
strong.
you want, just message me, okay?
Okay, sir. Okay, sir. Okay.
Okay. Dr. Phoebe, your scenario, 65 years old male patient, Mr. Harvey, has been experiencing bone pain and anemia. He has renal impairment. Now he is sitting in the consultation room after a series of blood tests and bone marrow biopsy. He has been diagnosed as multiple myeloma. You are a resident doctor, need to explain the diagnosis, answer his concern, and discuss the management plan. So it's a disease counseling.
Okay.
Let's go back to Dr. Muhammad again. Another comment when I read the scenario, I remember you mentioned your task or your position, Dr. Muhammad, as a resident in medical. And what they wrote in the scenario, it was you are the senior house officer in the medical clinic or department. So don't change your role or don't change your position. Don't put it as something you want to say. If you forget,
Mhm.
say simply, very simple way, I am one of the doctors here, either senior house officer, resident. So if at least you didn't change the position. So fix it as I am one of the doctors here. either here in a clinic, either here in department, either here in emergency. It doesn't matter. But don't say department different than the one in the role. And don't say another position which is not mentioned in your role. So make it as general word or sentence, I am one of the doctors here. Whatever you are here or wherever this place is, still you are in a proper way. Okay?
Yes.
Any comment else? Yeah, I addressed the point of inviting. So it's the YouTube video. It's a very short video, by the way. When to mention or when to invite, it's 2 minutes or maybe less, or I think more than 2 minutes, or but less than 3 minutes. When to invite and when not to invite someone to a scenario or a communication scenario and basis. Okay. It will not take time, I mean, to hear it or to listen to it. If you're ready, Dr. Phoebe, let me know.
Yes, doctor, I'm ready.
And his tone was
Oh.
great. Yes, I agree. Dr. Muhammad tone was great. Yes, he used very sympathetic and empathetic way. Let's start. Here
Okay.
you go, Dr. Phoebe.
Yeah. Hello, I am Dr. Gwalla as a doctor in the medical unit for today. May I confirm that I'm speaking to Mr. Harvey, 65 years old?
Yes, doctor, I am Harvey. Okay.
Yes, Mr. Harvey, we are here now to discuss about the update of your health condition. Is this okay with you?
Yeah, it's fine.
Mr. Harvey, do you want anyone to attend our meeting now?
No need. No need. I need to be
Okay.
alone here.
Okay, Mr. Harvey. So, can you tell me what you know about your condition so far?
Doctor, I was complaining of long-lasting pain in my legs and back. I also had some change in my the color of my face. And also recently, I have to start some heaviness and swelling in my leg. The doctor told me that I was complaining of some long-lasting illness, but I was not sure of this illness. And they draw some blood and doing some investigation, including sample from my back. But they told me that you have just only infection.
Mm-hmm. I'm so sorry from what you are suffering, Mr. Harvey, really. And if you have any pain right now, we can give you some painkillers if you want.
I am taking morphine for my pain, doctor. Is it good?
Okay, Mr. Yes, doctor, no problem. Yes, Mr. Harvey, no problem. So, can you tell me what's your expectation about our meeting today?
I have nothing. As I said, I think I have just only infection. I might have
Mm-hmm.
some loss of blood, maybe because of loss of intake. I am recently get upset because of too many stress in my life. I'm not taking too much food, and so I think I have only simple infection and iron
Mm-hmm.
loss. Yes.
Mm-hmm. I really consider your expectation and your concern is Mr. Harvey. As you told, you do some blood test and also snip from your tissue inside your bone. So the results of all this test come to me, and I'm so sorry, Mr. Harvey, that it is not as we hope.
Why you are feeling sorry, doctor? Is there
Uh,
something serious?
I'm so sorry, Mr. Harvey, that to tell you you have a cancer in the blood called multiple myeloma. Did you ever hear about it before?
I have cancer, but I'm very fine.
Uh, I'm so sorry, Mr. Harvey, for telling you this hard and bad news today. I'm really sorry, and my heart with you, and I really so sorry for what you are suffering. But be sure that we are here to support you and to give you the proper care and the proper management as a best interest of your case. Are you following me?
Yeah, doctor, thank you.
So, did you ever hear about this before, multiple myeloma?
No, I never imagined I have cancer even in my life.
Do you want to? I'm so sorry, Mr. Harvey. I'm so sorry, really. Do you want me to explain more about your condition?
Yeah, sure, doctor, go ahead. I need this. I'm
Oh,
very sad now.
okay, Mr. Harvey. Mr. Harvey, multiple myeloma is cancer in one of the blood cells named plasma cells. And this cause many symptoms like bony pain. Also, is a bone when destructed or destroyed from this or get disturbed from this cancer. So a salt named calcium is released in the blood, and this may affect also the kidney function, causing impairment in the kidney function. And also because these cells become uncontrolled growth of abnormal cells, so it may affect the production of the other blood cells, like the cells called white cells, which is one of the part of our defense system in our body. So it may raise the incidence of getting infection, and also it may affect the red blood cells, which is responsible for supplying oxygen to the body parts. So it may cause also pallor and low blood count, causing the fatigue that you have, and also all symptoms that you have is related to this condition.
Doctor,
And
doctor,
you are
do
following?
you,
Are you following? Yeah.
yeah, I'm following you. Do you think my back pain is fracture?
I appreciate your concern, Mr. Harvey. Yes, it may be fracture because, as I told you, the cancer, when it is in the blood cell in the tissue inside the bone, so it may cause disturbances and some destruction in the bone, causing fracture. So this pain may be due to yes, some fracture in your back, or to
But doctor,
disturbances in your back.
I have done CT scan of my back. It was completely normal.
Yes, I told you that it may be a fracture or maybe due to the expansion of the soft tissue of blood inside your bone. Maybe this or maybe this. It's one of the complication of this cancer is the fracture, the failure of the kidney to function well later on.
Mhm.
And I'm so sorry to tell you that it may also affect your lifespan. I'm so sorry to tell you this. It is serious if not treated well. Uh, so right now, Mr. Harvey, our plan is to involve the blood doctor, the cancer doctor, the Macmillan nurse, the specialized social worker, occupational worker, and also the psychological specialist to give you the best treatment and the plan of management in the best interest of your case.
Thank
How
you.
this sound to you?
You did well, doctor. Thank you. Everything is clear to me. But I have some concern. I am retired man. I cannot afford all these sophisticated tests and investigation. But why I have just only mild low back pain? They wrote all body CT scan. Do I need this CT scan and too much radiation? And as you know, radiation might harm my cells, my body. Do you think it's fair to send for all this CT scan?
I appreciate your concern,
2
Mr.
minutes
Harvey,
left.
but it is one of the tests done for patients with multiple myeloma to be sure that there is no fracture or no to also discover any lesions in the bone of the back, especially. So CT scan or the image done for
Yes.
your back is a part of the plan of management and investigation to reach the diagnosis. So right now, Mr. Harvey, as I told you, our plan, and you will be started on a medication named chemotherapy, which kills the cancer cells, and this medication will cause. It is very strong medication to fight against the cancer, but also it has some side effects, right? Like fall of the defense system and increasing the risk of infection. It may cause fall of your hair. It may cause also some fatigue, feeling sick, being sick like this. But we will try our best to handle all these side effects and also to monitor you before every session of this chemotherapy to be sure that you are okay. We will do some blood test for you before every session, and if you got sick or any sore throat or any flu symptoms, you must to seek medical advice at once. How this sound to you, Mr. Harvey?
It's interesting, but doctor, I don't need all this chemotherapy with all these side effects. Is there any alternative treatment?
I appreciate your concern, Mr. Harvey, but this is the chemotherapy is very important to be taken in your condition, in the best interest of your condition. So,
What about
and
transplantation?
what?
What about
Sorry.
bone marrow transplant? I hear this. This
Time,
will
time is
widen.
up, Mr. Harvey. MashaAllah, Mr. Harvey is well organized and has more knowledge.
Yes, that's why I can't complete.
Time is up. Thank you, Dr. Phoebe and Dr. Muhammad. Very nice performance by Dr. Muhammad, more than Dr. Phoebe. The surrogate is too much informative.
He is a doctor.
Yes. Okay, Dr. Muhammad, your comment, then I will comment.
But
Uh,
Dr. Basim, I wanted to tell something that I
Okay,
didn't
okay,
finish.
yeah, go ahead. Go ahead, yes.
Can we finish it?
Yeah,
Or
finish
no?
this
give
concern.
her,
Yeah.
Dr. Bassam, give her 2 minutes, please.
Okay,
Because
finish
I have
this
some
concern.
question, important question.
Okay, still more concern. Okay, take your time. I'm waiting for you. Go ahead. Carry on,
Yes,
Dr.
doctor. Yes,
Dr.
doctor.
Phoebe, doctor,
Yeah.
what about bone marrow transplantation? It's one of the possibility. I heard about this.
Y-
Uh,
Yes, your concern is valid, Mr. Harvey. This another alternative. Yes, we can discuss this with the cancer doctor and the blood doctor, and they will run some investigation for you. And according to this investigation, they will decide what is the best interest in your case regarding this issue. This okay with you?
yeah, thank you.
Yeah.
Thank you.
And for chemotherapy also, if you agree to take chemotherapy, so you will sign a consent for this before, and a form to tell you everything about chemotherapy, and you have to read. And after this, if you agree, you will sign, and you have the right to withdraw if you change your mind at any time. So, can I ask you some question, Mr. Harvey?
Yes, sure, doctor.
Okay, with whom you are living?
I'm living alone with my brother. Yeah,
Mm-hmm.
with my brother, old brother, yes.
Do you need any social support or financial support?
I am retired, yes. I get bothered with all this investigation. I need some support, yes.
Yeah, I will refer you to the social workers. They can help you regarding this issue. Are you smoker?
No,
Are you drinking alcohol?
no, not at all.
Okay, can you recap for me, Mr. Harvey, what you get from our meeting today?
Okay, doctor, I was complaining of pain and back pain and anemia, and I was complaining of leg swelling. You thankfully have done some investigation like blood test and bone marrow sample, bone sampling, and you told me that this case is a case of multiple myeloma, which is a malignancy or cancer inside my bone. I have to get some important investigation and important therapy or treatment like chemotherapy, and one of the possibility for treatment also is the transplantation. That's all. Yes.
Okay, I will give you some brochures, leaflets, and websites to read more about it. And
Believe
I
me,
will
he
give
doesn't
you
need this leaflet. He knows everything.
and I will give you the contact number of department. Don't hesitate to contact us at any time. Thank you, Mr. Harvey. Do you have any more concern?
Oh, thank you, doctor. Thank you so
Okay,
much for all
thank
this
you.
information. You are a very clever doctor. I appreciate you have to be there in this hospital. I'm very thankful.
Thank you. Thank you.
Okay, well done, Dr. Phoebe. Let's hear the comment from Dr. Muhammad, please. Muhammad, go ahead.
Dr. Phoebe was systematic, but one thing I need to focus on. She was don't giving me some space to talk about myself, and she was giving too much information without any punctuation or pause. I think she should make some space between all this information because it was too much, and she has to mention all these, but with some spaces or pauses between them. This is first. The issue behind the chemotherapy, behind CT scan, sorry. I was meaning by CT scan all spine because the multiple myeloma, whole spine, because multiple myeloma has patchy nature. So the CT scan of localized area couldn't be diagnostic too much. So he has to do whole body CT scan and PET scan. This is the issue behind this. And about the transplantation, is one of the possibility. And I have to ask one other difficult question about transplant. From where I have to get this donation or donated cells. The best thing I have to take donor from my brother, allogenic sample from autogenic sample, non-allogenic sample, because my brother was my twin, and to prevent rejection and failure of the transplantation, because I have 65 years and I have diabetes mellitus renal impairment. I don't need the transplantation ends up with rejection again. This was one of the concern. I hear this side effect of transplantation in one of the station, not the MRCP, in other examination, international examination. Yeah, the best fit, or I mean the best suitable bone marrow transplantation for 65 years. Multiple myeloma is the autologous one, not the allogenic.
So it's less than 55, not more than. More than they will do only chemotherapy without thinking about bone transplant or stem cell transplant. I mean, the elderly, they are not candidate for stem cell transplant. Isn't?
Yes.
Yeah,
Yes.
I believe, thank you, Dr. Muhammad, for your comment, but I believe the chemotherapy will not be the task in this scenario. You are talking about the disease, not about the management. As you did, Dr. Phoebe, for me, if you mention the team, it's fair enough, and no need to mention the chemotherapy unless it was written, it's one of the plan to speak about chemotherapy.
I
Why
do
I'm
it this, doctor, because the in the scenario mentioned that to discuss the
management.
management plan, and the
Yes,
management plan is mainly chemotherapy, I think.
yes, I agree. But if you start to speak about chemotherapy in details, you will not give him time to address all his concern. That's why he give you a lot of concern. So instead to mention the chemotherapy, listen to him first And I agree with Dr. Muhammad. You are perfect, Dr. Phoebe. MashaAllah. I said before, you have the skills of communication. What meaning? You are not saying jargon. You are saying or you are maintaining the discussion in the simple way. You are doing a conversation way. But please give him space, as Dr. Muhammad said. You didn't give him space to ask you or to say, I am understanding, or I have comment, doctor, about this. You are explaining well, but in every sentence, ask him, are you following me? Did you understand what I said? Because he might interrupt you with a question. And once he starts, believe me, this will might harm your mark. Whenever the surrogate start to speak, be quiet. Be quiet at all. Because it was one of my comment in my exam that I interrupted the daughter. Although I was saying to her, I appreciate your concern. That's it. They mentioned I interrupted the daughter, and it was 1 mark. And this 1 mark failed me in the skill that I failed in the whole exam. It was communication skill. Why? Because she kept shouting at me, and I am saying to her, I appreciate your worry, I appreciate your concern, I'm sorry for your feeling, and she's shouting. And one of the examiner commented that I am interrupting the daughter. Imagine how unfair they are. So please, whenever the surrogate start to talk, let him talk. Stop your talking at all, because I noticed in this scenario, you are talking and Dr. Muhammad start to say something, but still you keep talking. This thing, believe me, it will irritate the examiner. Other thing also, eye contact. They are commenting a lot about eye contact. You have to look at her eyes or at his eyes. Whatever happened, look at him. Look at his eyes. Focus on his eyes all over the scenario. Don't let him or don't look away from him. Okay, this is another comment and advice which is not practically common, because we are not sitting together to know if we are looking at each other or not. So please, whenever you have communication, look at his eyes and focus with him. Let him talk with you. Let him ask you, and let him do as a conversation way with you. Apart from this, Dr. Phoebe, really you are doing great. You do the breaking bad news perfect. You give him a warning shot. You kept quiet for the golden silence, multiple myeloma, cancer. Then you kept quiet. You let him react. I think in this skill, you get full mark, but just give spaces for the surrogate, as Dr. Muhammad said. I will not comment about the chemotherapy, because yeah, it's as for me, it will be another task. Chemotherapy will take a complete session, 10 minutes for chemotherapy. Why? They will have concern about the sperms, they will have concern about the hair fall and the wigs. You have to offer him a wig to compensate or to overcome this problem. For the sperm, also, you will offer a sperm bank. So you have a lot to talk in chemotherapy task. But I believe this scenario, as a breaking bad news, counsel about multiple myeloma, that's it. What you mentioned for the team is fair enough to speak about the possibility how to manage this patient. So we have a team composed of one chemotherapy, or sorry, the oncology or the cancer doctor. As you said, also the Macmillan nurse. As you said, bone doctor. As you said, mood doctor. Don't say it's psychological. It's jargon, okay? This is the only jargon you mentioned. And
Dr.
social
Bassem,
worker. Yes.
sorry to interrupt. Again, I have a habit nowadays always to go back to the NHS because they are the one who is examining us. So when they are explaining multiple myeloma, I have one comment first. When he said, I have a cancer, but I am feeling fine. There is one word I noticed that in NHS they wrote, not everyone need to have the treatment for multiple myeloma, by the way, يعني at the moment, but later on maybe they will have the treatment. So this is an opportunity for you to say that. And every patient who told you that he's feeling fine, it's good to appreciate his feeling. So I am glad that you are feeling fine. I'm glad that you are feeling fine. But this is the situation now, and don't worry, we will be with you at every step. Do you want me to explain for you more about this condition. So I think, Dr. Phoebe, you're asking yourself how I will draw to explain multiple myeloma. It's simple. You have to draw the bone, because if you draw the bone and explain to him that multiple myeloma is when you have, this is your bone. In the center of the bone, you have a spongy area, which is the factory to produce your blood cells, the different blood cells. The multiple myeloma cancer is the cancer which is affecting the white blood cells, one of the type of your blood cells. It is responsible for creating the defensive system which should defend your body against bug infection. That's why when you have multiple myeloma, and multiple myeloma is when this misformed white blood cells in this factory will build up to replace all the other blood cells. So you explain three things. Now you will make it obvious for him. So when you have multiple myeloma, firstly, because of the build up of the misformed blood cells, you will have thinning of the bones and might have fracture of the bones. Secondly, because you have misformed white blood cells, which is responsible for defending your body, we might have infections, bug infections. So, thirdly, because you have built up of this misformed blood cells, the other type of blood cells will be less, and that's why you have anemia, less blood cells. So these are the three complications of the multiple myeloma. And you mentioned already, I'm glad that you are feeling fine. Not all patients of multiple myeloma, they will have to have treatment, by the way. But let me explain to you more about that. Then you enter the explanation and draw the bone, draw the center. This is the spongy part, and this is the factory. And then, like I said to you, then after that, you ask him, of course, you check understanding. Are you with me up to now? Now I will explain to you how to treat this condition. Multidisciplinary team, like so. And the aim of the treatment is two things: to anticipate and prevent every complication that could happen from your cancer, and secondly, to give you some medicines to kill this misformed and build up of cells. These medicines could be in the form of oral medicines, could be in the form of chemotherapy. That is a medicine given to kill these. Yani mention it in the management plan. And this will be explained to you more and further when you will sit with the multidisciplinary team, and already you explain the multidisciplinary team. Like this, you covered chemotherapy if they want you to cover it, without explaining further and saying too much things and side effects and entering to these things. And in the same, you mention it. You did your part and you mention it. This is how I see this. If anybody have any other comments about what I said, I'm very happy to listen.
Thank you, Dr. Salma. But again, wallahi, Dr. Phoebe explained it in the same way you explain. I mean, it's fair enough. Even drawing, it will be more complicated. Why? Because what you will draw, a bone or a kidney or a blood count or anemia, it's complicated figure. Anyway, if you have
No,
a way
Dr.
to say,
Basim, just listen to me. By drawing, you will get the attention of the surrogate or the patient and the examiners. All
I
of them.
agree to draw, but
So they
what to
will
draw?
listen to you with joy.
Yes, but what to
Draw
draw? This is the problem. What
just
to draw?
bone.
Which bone? Which bone you will draw?
اسطوانة
It's
اسطوانة كده, and
complicated.
in the center.
Wallahi,
Yes.
for me, Dr. Phoebe did it in a simple way. For me, I will not draw in multiple myeloma. Anyway, always I'm saying follow what you are feeling comfortable with. If you feel comfortable with the approach of someone, follow it. If you feel approach of yourself comfortable with, do it. But try to make it in a proper way. So again, you did it also in a great way. But as Dr. Phoebe said, she said the components easily without drawing, which is if she draw, I think it will make it complicated, and he will misunderstand the disease well. It's easy. Blood count will be low, the bone will be weak, and the infection might be more risky because of low white blood count, which is responsible for defense system. In general, you did as a great one, and also Dr. Phoebe approach was okay, but everyone has his approach, and I don't want to disturb which one you will follow, but be always simple as much as you can. This is the general advice. Be simple in everything, in your words, in your talk, in your sentences. Okay. I want to add a comment regarding Dr. Phoebe when she is saying, I told you. This way or this word, they don't prefer it for you and for everyone, Dr. Phoebe. Dr. Muhammad also use it. So don't say as I told you earlier. Means that you are not understanding my talk. You have a problem with my talk. No, you can say as we have been discussed or as we have discussed. So don't say as I told you. Okay. This word make the examiner irritated because it's assumed that the surrogate did not understand or he is not understanding because of something in his mind. So better to say, as we have discussed earlier, this thing happened and blah blah. Okay, try to
Yes,
remove
doctor.
it. Yeah, try to remove it from your dictionary, as I told you. Everyone, not
Uh,
only you. Yes.
Yes.
Any comment, Dr. Phoebe?
yeah, regarding to the treatment,
Uh-huh.
as Dr. Salma told, there is in the early stages of multiple myeloma, there is no treatment. Is this sure?
I am, as I said, wallahi, always follow the task. If they wrote for you chemotherapy, you will talk and you will spend a lot of time for chemotherapy. Why you will speak about chemotherapy and they didn't mention it? As Dr. Salma
Uh,
said, yeah, by the
I
way,
will
Dr.
take a
Salma,
screenshot, Dr. Phoebe, for you and send it to the group from NHS.
yeah, Dr.
Yes, please.
Salma
Yeah.
saying this with me, it's not against me. So
Mm-hmm.
it might not be the time for chemotherapy. Why you speak it? Why you speak about it? You got it.
Mm.
So don't speak about something which is not in the task. It might not
Yeah,
be
he's
the time
right.
for chemotherapy. Yeah, maybe
I will send
early
you. Yeah,
yeah,
I will send you also the
Mm.
answer from NHS. They wrote just highlighting treatment to kill the overbuild cells and
Mm.
treatment to prevent infection. Uh, just without
okay.
mentioning, you can just mention the treatment to kill the over crowded
Overgrowth.
cells in the
Yes.
Mm.
form of kada just by mentioning, not in details.
Yeah.
Mm. Mm. Okay.
And the chemotherapy will be a separate scenario and a separate task. It will not be two tasks together, multiple myeloma and chemotherapy. It's so difficult to find the time to fill up all this medication and the disease. So the best way, as you did earlier, the multidisciplinary team or group of specialists, including 1, 2, 3, 4, 5. Don't speak about what is the management plan. They might say you invented that medication, right? Because it wasn't there. Why you said chemotherapy? They might harm your mark in the clinical judgment. Why you said chemotherapy? Maybe early stage, maybe late stage, and the patient will receive palliative. So it's not the
Mm.
time now to talk about what specific medication. Just say we have a group of doctors. They will follow you. They will give the best interest for your condition. Macmillan nurse, I agree. It might be there or she might be there because of the possibility of chemotherapy, but don't specify what you will give to the patient. Okay.
Okay. Okay.
Okay. Thank you, Dr. Phoebe. Any question or comment from other? Dr. Ahson, yes, but beside what Dr. Salma said, it is an incurable disease. So we go step by step, no symptoms, no treatment, and keeping increasing from chemo plus steroid plus oral tablets, biological BMT, biological, I think. BMT, what's BMT?
Bone
So
marrow
better to tell,
transplant.
yeah, bone marrow transplant or stem cell transplant. Okay. So better to tell lots of options available and MDT, okay, of course, not to the patient. Don't say MDT to the patient because it's a jargon. So you can say group of doctor will decide about your management plan. I agree with this. Be diplomatic in this way and in this part of the management. You don't know what will be the management plan. Okay, if he raise it, yes, of course you have to talk about. If the surrogate say any possibility to start what's called chemotherapy, yes, there is. And try to be sympathetic in this. Sadly, I am sorry, and I'm afraid to say, yeah, there is a possibility. Also for the CT, as Dr. Muhammad stressed on this point, you did for me the CT many times. I'm worried about radiation. I'm so sorry about your feeling. Always we are deciding for a procedure when we are when we are suspecting a benefit more than a risk. So this is our decision in the best interest for your condition to do this CT, and no worries, we are following our protocol to prevent further side effects. Okay.
Mm.
So we are always outweigh the risk and benefit for any medication, for any procedure. We are not doing these things unless you have benefit more than the risk. Of course, not anyone coming to you will do for him CT brain. If someone walking healthy, you'll tell him, come, I will do for you CT brain. No, we are doing CT brain to discover something. We will do CT brain to check up something you might have. So it's how to convince by this way. Always we are outweighing the risk and the benefit of any procedure or of any medication. Of course, there is side effect, but always the risk and the benefit outweighed, and always the benefit outweigh the risk. That's why we decided this in the best interest for your condition. Clear?
Yes. Yes.
Yes. Okay. Any question or comment from others? Dr. Rufibi and Dr. Muhammad first. Any question or a comment?
Oh,
Yes,
everything.
I want Dr. Muhammad to repeat again about the answer for the concern about CT scan.
Okay. You need me to repeat the surrogate question?
Please. Yes. When the surrogate told about why you did CT scan, what will be the answer exactly again? Sorry.
I mean, first of all, the question was like that. I have doing CT scan in my back and whole body. But why we are doing this investigation? I have just complained in the lower back, not whole of the body. This was the question. The answer for me is like that. We were doing the CT scan because it is one of the main investigation in your disease. This is first. And second, we cannot do the localized CT scan because of the patchy nature of the illness. I don't know, Dr. Bassem, if any jargon in this patchy nature. Because the multiple myeloma has no continuous lesion. It's a single spot localized everywhere, maybe in
Yeah,
the
but
upper back.
it might be everywhere. Yes. So we have to discover everywhere.
Yes.
It might be in any bone, right?
Yes, any bone
Mainly
in
the
the
back.
skull, in the chest, in the back.
Exactly. Mainly or most probably in the back, but it might be anywhere else.
Yes, anywhere else. So why we have to do all this scanning from the top to the bottom? All of the body should be screened by CT scan.
I agree. So this answer, and again, Dr. Phoebe mentioned the risk the benefit outweigh the risk. It's a
Yes.
benefit here to diagnose you and to diagnose the condition and to find out any abnormal growth anywhere. So this is the way how to convince. Always use the way the word, the risk and the benefit outweigh the risk, and it's
Are you
the best
following me,
interest
Dr.
for you.
Fiba?
Yes,
Yes.
yes, yes.
Okay. And also you can say this is one of the diagnostic tools in this condition. We have to do it. This is one of the protocol how to diagnose this condition by doing CT brain or CT bone to diagnose where is exactly the lesion or the
Mhm.
abnormal growth. Okay.
Yeah, sure. Thank
Any
you, doctor.
question, Dr. Phil? Most welcome, Dr. Phil.
And Dr. Bassem, through the CT scan, also we can do CT guided biopsy for that. We
Yeah,
can take
this is the
sample
next
from the
step.
area.
Yeah, of course.
Because multiple myeloma
Bone marrow biopsy.
occasionally appeared as a mass without CRAB phenomena. It's called plasmacytoma.
Mhm.
Okay, the
Yeah, bone
plasmacytoma
marrow
is
biopsy,
localized.
yes. As a
Yeah,
diagnostic,
the
yes.
localized biopsy can be helpful in this
Mhm.
case.
Yes, exactly.
Yes.
Thank you, Dr. Muhammad, for the practice and preparing the case. Thank you, Dr. Phoebe. Any question before ending the session. Any question from other comment? Any other comment?
Thank
Any
you,
doctor
Dr.
has? Most welcome, Dr. Muhammad, and anyone also welcome to practice. This is the way how to get confident and how to gain more information and how to gain more skills in this communication. It's nightmare for some doctors, but it's easy way when you practice it a lot. You might face a scenario in a session, and this scenario will come to you in the exam. Easily you will do it in a proper way, you will get the full mark. So this is my role. Study free, practice free, and do as much as you can sessions or scenarios. Okay?
Yes. Thank
Thank
you,
you
Dr.
everyone for listening to us
Thank you,
today.
Dr. Fiba.
Thank you, Dr. Phoebe, Dr. Muhammad, Dr. Salma for the comments, Dr. Ahsan, Dr. Muhyiddin, everyone in the session. Have a nice week and see you inshallah after the weekend. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.